What are your thoughts as far as they are rolling out this vaccine at such a fast pace, and how it should be distributed, and whether or not it's going to be effective? I don't know. It's like, next month we're going to have a vaccine. Is this, well, what are your thoughts and take on that?
All right, I'm gonna tell you my thoughts, but first I'm gonna tell you a story. I practiced medicine for a long time, and I had many patients that were with me for a long time. And every year I would try to get them to take the flu shot. And, sometimes they did, sometimes they didn't. I understand people's hesitancy. My parents, both of whom have passed, but my parents in their old age, I would, like any good daughter, I would be trying to help them navigate the health system. And one day I remember they were sitting in the kitchen, they looked at me and they said, Linda, we don't trust doctors, and we haven't forgotten you're one of them. These are my mother and father. So I understand people's hesitancy. I am not concerned that nothing is 100%. Don't misunderstand me. I am not concerned about the present vaccine development process. This is why. I'm ignoring that we had an idiot in the White House. I'm ignoring him because fortunately, he really couldn't mess with that process. It's a process that was a governmental, private, pharmaceutical process that he couldn't get his hands on. So don't worry about that. I don't care that he called it warp speed. It's a stupid thing to call it. So we have a process in place for how we develop vaccines and how we test vaccines. And there's new modern tools that we have for how we develop vaccines. Again, I'm oversimplifying it. Please forgive me. In the old days, and we still do this with some vaccines today, but in the old days, we would have to grow the vaccine basically in eggs or stuff. Today we have more modern techniques, so we can actually make the vaccine faster. In this case, again, 20 years ago, we wouldn't have had this. Right away in January, we had already sequenced, we already knew every little piece of this virus, okay? The DNA, the sequence of the virus. And that, again, that makes it easier to do a vaccine. The whole world knew it, not just Trump or not just the United States. The whole world scientific community knew it. And the whole world got together quickly. That's why there's so many different vaccines being developed. China, Cuba, the Soviet, Russia, England, France. You got all these groups all over the world working together in different teams developing this vaccine. So that's the first reason I'm not concerned about it, because I can see as I read around the world, all these things are going down similar paths. The second thing is Dr. Fauci is an excellent scientist. He's looked at this much. He's seen information that's not public. I can't review it yet. And more importantly, he's more qualified to review it than me. He's confident. And other friends of mine that are around the world that do this for a living are confident with what's being done. So I can tell you that the development of the vaccine was fast, but that's because we have new tools, etc. The actual clinical trials have not, nobody's cut corners on those in the United States. And again, while I have not seen the actual data yet, it will be out. Some people have seen it. I just haven't looked at it. But it will be out. And so I'm confident that they're using the normal mechanisms for the trials, how many people, etc. So even though it's going on fast, it's mostly because we put so much money and so much effort by so many scientists to have this done so quickly. Now, does that mean it's 100% we know everything and we need to know about it? Absolutely not. It doesn't mean that we understand everything, but if we had taken longer, we would still be doing the same steps. If that makes sense. So no step has been skipped. That's really what I'm trying to say. Now here's the tricky part. I'm never going to tell somebody, especially somebody that's a person of color in this country, to just assume that something bad might not happen. I would never say that. But I certainly will, as someone over 70. When it comes my turn, it'll be relatively early. When it comes my turn to take the vaccine, I'm going to step up there and take it. All vaccines and all medicines have some side effects. So I'm not surprised But most of the common side effects we should be able to see by the trials that we have going on. And don't forget, it's not just our country that's trying these vaccines; they're being tried in other parts of the world too. And I know Cook County system, which is my basic home system. I know that Cook County and University of Illinois, we've participated in a number of all these vaccine trials. I think at least 2 we've participated in. So I am as confident as we can be. Again, at my age, I don't need to be running around unvaccinated if there's a vaccine available, because my chances of dying should I get infected are huge compared to my granddaughter's chances of dying. But this is a discussion we have to have, and I think people are going to have to learn a lot more about how we make vaccines, because I know in our community this is a real concern and a real fear about this, especially unfortunately with President Trump. It certainly doesn't lend one to be trustful. So that's going to be something we're going to have to work on. But personally, I'm very happy with what's going on, and I won't hesitate to get the vaccine when it's offered to me.